Hi, my name is Azra Wellbaum, and this video is a summary of my final paper for History and Principles of Health Education, titled From Moral Failing to Public Health Crisis: The Evolution of Substance Use Disorder. Today, I'll briefly cover the historical shift in how society defined addiction, the role of social determinants of health, and current public health approaches. Substance use has existed across civilizations, but the meaning attached to addiction has changed dramatically. For centuries, excessive use was viewed as moral weakness or sin, leading to responses focused on punishment and social control. In the United States, movements like temperance and later prohibition tried to solve addiction through moral reform rather than medical care. Early federal policies such as the 1906 Pure Food and Drug Act and the 1914 Harrison Narcotics Tax Act framed dependency as a legal problem and not a health condition. By the mid-20th century, research and community models like Alcoholics Anonymous began reframing addiction as an illness. Neuroscience later confirmed that repeated substance use changes the brain's reward and decision-making systems, positioning addiction as a chronic disease rather than a lack of willpower. However, the 1970s war on drugs shifted back towards criminalization, leading to mass incarceration and unequal impact on low-income and minority communities, a tension that still affects policy today. One of the most important takeaways is that SUD does not happen in isolation. Risk increases with poverty and unemployment, limited education, trauma, discrimination, lack of access to treatment, and stigma also prevents people from seeking help and even influences provider behavior. Recent data shows rising overdose deaths among Black and Indigenous populations, highlighting ongoing inequities. Research shows that recovery is strongly supported when people have stable housing, community resources, and equitable access to care, proving that treatment is not only biological, but also social and environmental. Today's strategies look very different from historical approaches. Public health now blends prevention with youth resilience programs, treatment, including medication-assisted treatments like buprenorphine, methadone, and naltrexone, harm reduction such as naloxone distribution, syringe service programs, telehealth expansion for rural access, and policies are also shifting towards diversion programs that send people to treatment rather than jail. Even with progress, stigma remains the biggest barrier, limiting support for evidence-based interventions and slowing adoption of effective programs. The future of SUD response will depend on interdisciplinary collaboration. Growing needs to include health educators for community prevention and stigma reduction, epidemiologists to track overdose trends, behavioral health providers for counseling and MAT, policy experts to expand treatment access and insurance parity. And as public health continues reframing addiction as a treatable condition shaped by equity, demand for these roles will only increase. In conclusion, the history of substance use disorder reflects a major shift from punishment to public health. While science and policy have advanced, lasting progress depends on addressing stigma and the social conditions that shape addiction. Thank you for watching.